obviously, understandably, a little bit nervous initially, but we had lots of on-the-job training, and in fact we all loved being able to do something so useful and so important at the peak of the crisis.
Hello, I'm Nicole. I'm one of the respiratory physios, and during the COVID-19 pandemic we had to cancel classes and then was redeployed over to North Tees. So I became part of a team delivering training to new band 5s, people who didn't have a lot of respiratory experience, to get them up to speed and ready to work on the respiratory wards.
We were redeployed in March to help out in intensive care.
Myself, along with about 40 of the other MSK physios, were redeployed at the initial part of the COVID crisis to our acute hot site.
Because the X-ray and the CT were among the first line diagnostic tools for COVID-19. So that necessitated my redeployment to the X-ray unit.
I've been redeployed to the oxygen running team.
Then I had extra in-house training from ITU to do nursing ops, ECGs and how to set up a ventilator and run the safety checks.
My role generally on the wards was to try and assess both the sort of pulmonary or chest aspect of the patient's health to ensure that they were clearing and maintaining their oxygen levels effectively, which is obviously quite important when it comes to COVID. The other aspect of my job was to assess the patient's mobility and ensure they were safe to go home as quickly as possible.
On ITU we were working 3 days a week, 12.5-hour shifts, so completely different to our normal jobs. So we were basically assisting the nurses to look after the patients on intensive care.
And then I was redeployed again onto the CAT team, so that's the Community Integrated Assessment team. So basically it's myself and 3 other physiotherapists and an OT. We go out to the care homes where patients have been discharged from the hospital into those rehab beds, and we just continue their care away from the hospital setting.
It also got me back in the inpatient setting. I hadn't been there for a while, so it was nice to actually get to work with the sort of wider MDT, because we don't really get to work with them as much or as face to face. It's been a hugely daunting challenge for me to come in to a hospital situation, especially going into ward areas which are alien for me and for most of my team. We've seen younger junior physios basically taking ownership of the team, leading our senior physios in what they should and shouldn't be doing.
And I think it's been we're in this together feeling for the whole of our organisation, which is both community and acute. So I think it's been a really positive, one of the positive things out of such a really difficult time.
Jake and I have been asked to be PPE officers, and we were provided with loads of training from infection control and from obviously Public Health England around the guidelines for PPE. And within this role then we've been asked to train the whole therapy team, so that includes physiotherapists, occupational therapists and all the assistants, the specialised therapy assistants. So we've had the opportunity to train all those people as well, so that's been really educational for us.
I've learned a lot from this experience. I've learned that we have a brilliant team who are very resilient and adaptable.
I think everybody's gone through their own personal experience. I know I've lost family members over this period, and that support from the leaders from an emotional aspect, but actually just from a work aspect as well was really, really good. So
and it's really nice to see that everyone's supporting each other, whether it be the different shifts like Jake's talked about or the PPE challenges. You know, everyone's just helped and supported each other, so it's lovely to be a part of the team.